And so what has been your experience in helping women with their reproductive care with the community in New York?
Yeah, I've had the privilege of really working in many different types of communities. I've, landed in the FQHC world in the last couple of years
Okay.
where I feel most comfortable. But I can definitely say that, all women are pretty much very similar in terms of what it is, the things that really keep them up at night. What
Hmm.
are the things that they're most concerned about their health? Really kind of putting their families first and kind of really trying to ensure that both themselves and their families are healthy. I think one thing I've noticed in kind of working specifically with the population that I work in the Bronx, which kind of led me down this path towards being more vocal about justice, is that there are a lot of women who have experienced really had negative experiences with healthcare, particularly poor women, women of color, issues of not only physician bias, implicit bias, medical racism, discrimination when they interact with the healthcare system, but also trauma. People who
Hmm.
sought out gynecological care, gynecological services, and felt as though their bodies were disrespected, were not valued, even in just the examinations or the care, lack of care that was taken with that. As you know, many women, regardless of their socioeconomic status or their station in life, may experience sexual trauma in their lives, sexual violence. It's not something that's uncommon. And with that, going to the doctor and having, to relive that or having some of those traumas, it's kind of like ripping off a Band-Aid, right? Like creating
Hmm.
these fresh wounds can also be equally as traumatizing, if not re-traumatizing. So what I was finding is that, one, my practice, which has traditionally been a family medicine practice with infants and children and old people and young people and men and women, and also individuals across the gender spectrum, was now kind of transforming into this practice of young reproductive age women
Hmm.
of
Hmm.
color.
Hmm.
So I kind of started to ask this question, like, why is this happening?
Hmm.
And how did you find me? Because I'm in the most obscure part of the Bronx. And as I started to kind of dig and uncover, people started to tell me their stories. Like, it's because I want a Black doctor, something I would hear often, or I don't trust doctors. And my sister told me that you're, somebody who actually listens and cares. So people, unfortunately, going the extra mile was really kind of born out of people's negative experiences that they already had with healthcare.
Hmm.
So then, in kind of starting to uncover some of these stories, which were actually quite traumatic to hear, and really, I think in some respects, opened up wounds for me, because I've
Hmm.
also, as a woman of color, have experienced those types of treatments in dealing with healthcare myself, because I'm not somebody who typically likes to put out there like, hey, I'm a doctor. When I go into the doctor's office, I don't even really like going to the doctor, and I will be the first to
Hmm.
admit that I'm not super trustful either.
Yeah.
So hearing these stories from patients really kind of just really, I feel like, implored me to want to speak up and speak out on their behalf, especially since there are also women just like me